Okay, so now we're going to show the application of a PICO 7 dressing onto a dehisced surgical wound. As you may be aware, you can use PICO dressing with a filler underneath if that's required, and you can choose gauze and or foam, whatever's the most appropriate for the wound. Given that we have a wound with a sinus and some undermining, and it looks quite topically, locally infected, we're actually going to use Acticoat Flex today. That will give us our effective, fast-working antimicrobial to help work in conjunction with the negative pressure wound therapy. As with any wound, please make sure that it is appropriate for negative pressure wound therapy and complies with the indications and the contraindications for the therapy. Also, make sure you're following your local health protocols in regards to application of these dressings. Normally this would be done with a sterile technique, but we're just going to show you the non-touch technique today. If you're using your gauze or your Acticoat Flex and you need to pre-moisten it, make sure that you only ever pre-moisten your Acticoat Flex with water. Otherwise it will impact with the ability of the silver to be donated to the wound bed. As with any good dressing technique, we're going to make sure we pack down into the sinus first, in under that undermined area, and have a good coverage on the wound bed itself. We don't need to worry about overfilling this wound because remember the PICO dressing itself is going to suck down and maintain contact with that wound bed. Ideally, the dressing that you choose is going to fit the wound comfortably within this part of the pad. And that's to ensure that we don't have the port sitting directly over the wound because we want the exudate to come up into the dressing itself, not sit underneath the port. Okay? As with any other sort of standard dressing, it's just a matter of taking your strips off the back, placing down over the wound, and because you've got that nice silicone adhesive, you can then ensure that you've got good contact with the surrounding skin. At this point, it's always important to actually connect the pump from the PICO. We've put the batteries in the back, and now we're going to connect the end of the extension tube to the end of the dressing. If you choose, you can connect the end of the dressing directly to the pump and not use the extension tubing. Press the orange button. Help facilitate the initial suck down of the dressing. And you'll start to see that nice wrinkled prune appearance that you would expect when you've got a good vacuum. You'll get your green flashing light to tell you that everything's okay. This is the point where we can now put our fixation strips on to maintain that seal. When you're using the strips, it's important to note that if you need to cut them, you need to ensure that you leave one of the white ends on the piece that you're using. So we would always cut from the middle, and then we have two ends that we can use. Take the backing pieces off, apply to the edge of your dressing, not up onto the pad. Run your finger on the white edge of the strip and peel back diagonally. Repeat. And the same for your long sides. Okay, ensure you have coverage on all four sides, and then your patient is good to ambulate. Once you're happy with the dressing, it's just a matter of attaching the belt clip to the back of the pump and they're good to go. When it comes to removing the dressing, all you need to do, switch the pump off, disconnect. If you're going to change the dressing for that week, you need to remember to keep the pump and the extension tubing if you need it. When you're removing the strips from the edge, it's a stretch and release technique. And then when it comes to the pad itself, that will easily come away due to the fact that you've got that nice silicone adhesive contact layer. So, really easy to use, and just remembering what your standard indications and contraindications are.